Ndola Teaching Hospital is the second largest health institution in Zambia with a capacity of 851 beds and 97 baby cots. It is the referral center for the northern part of the country and it serves the population of 500,000 in Ndola district. The transformation of the health institution into a teaching hospital brings about an increase in service delivery, which comes with a number of challenges. Among them is increase in medical waste, which calls for proper way of waste management. It is for this reason that the United Nations have come up with an initiative of bringing a new system to manage the medical waste at the hospital with a project called Untended Persistent Organic Pollutant Reducing, funded by the United Nations Development Programme as well as by the Global Environment Fund and implemented by the Ministry of Health.
There is a great increase in the level of services that is being provided by this hospital, so the amount of medical waste which is being generated here is really high and increasing. So there is a need to help the hospital to have the most modern methods to be able to deal with this medical waste. So the new autoclave system should deal not only with the waste, but it should not produce additional waste into the atmosphere. So that's a very nice way to think about how do we end this process in the hospital. So for us, we found that this hospital is a very good place to bring this project. We will try also to link it up to another project that we are involved in, which is called Solar for Health. In other words, bringing in solar power to support the provision of health services in the medical facilities.
And the Ndola Teaching Hospital Head Clinical Care, Dr. Banda, stated that the project will not only benefit the hospital but the entire community and other private health institutions.
The waste disposal will not only benefit Ndola Teaching Hospital, but it will benefit also the primary health facilities as well as the private sector. Then the second thing again is that as a teaching hospital, moving towards the newer disposal of waste, it will serve as a teaching to other sites as well. And thirdly, the energy that is going to be generated. Okay, remember, during the periods when you have suboptimal electricity, we have to utilize fuel. We have to utilize diesel, and that money which we are going to that money can be utilized for drugs, can be utilized for reagents and so forth. So it means we're going to save a lot of money that is going to be utilized for other health services that ultimately is going to improve patient outcome.
Burning medical waste releases a number of hazardous gases and compounds, and the disposal of biodegradable waste produces greenhouse gas emissions, including methane, which is 21 times more potent than carbon dioxide. Hospitals can better protect public health by reducing the volume and toxicity of the waste they produce, and by implementing a range of environmentally sound waste management and disposal options. Evans Ban, Prime TV News in Ndola.